Good evening. Yes, love talk back, so I think we're going to have a talk back crowd today. I'm looking for Good. Well, I want to set the tone for the evening. I'm Shannon Isom, President and CEO of the Community Shelter Board. Thank you. I'm in my 10th or 11th month. Either way, I'm close to a year. And one of the things that I want to set as the agenda, it is imperative, it is important for us to make sure that we hold space for accountability. And so I am utilizing this space, I hope with your grace, utilizing you as an audience to figure out what we can do better, be more responsive, design and assess for the needs of community. It is also equally as important that as we build the responsive system, that we are not in the way. And so I would like to set the tone today that we need to hear from you. The reason why we are here and starting with the Southside is because many of you have already raised your voice, not only to the city and to the county, but to those that you hold responsible for some community issues that are going on, and from my understanding that you want answers. I am going to sit in this space and hopefully within this hour and a half, where I'm going to be listening to that, writing things down, as well as taking in some suggestions on what we should be doing. I'm also wanting to frame the responsibility that the community shelter has, as well as the partnership that we will promise with the city and with the county and with you as our stakeholders. I am first going to say I know that we haven't done everything right, but I hope that right now we get to right size things for what to do next, and that we do that together. We're going to hear a little bit, and we'll have a lot of people on this deck, but I'm going to go fast because the important thing is that we want to hear from you. This is less about us and more about you, and more about what are the goals of what you need addressed. So in saying that, I want to make sure that I am setting the goals again of intention, that this meeting is for this hour and a half to discuss the issues that Southside has and wants to bring forward. From our understanding that there is already good work being done in this community, that there are partners that are already showing up in this community that has to do with the unsheltered homelessness and also the homeless. However, that there may be some gaps in service delivery or some other issues around safety, around maybe even civility, that needs to be addressed. We want to be able to discuss that. I also want to bring forward some resources. So we will have some experts that will come here talking specifically about homelessness and housing, but also talking about the programs, the resources, and how do we engage with them. I want to rest assured that from the business community all to as well the community members, the residents, that you have what you need. And then finally, I'm going to introduce Rayma. Rayma is here to not only help us engage, but to quiet us if we're talking too much. To lead the discussion, that if there's someone that needs to have a hand up or to need to be voiced and heard, that they will also help facilitate this time together. So my short introduction, I think I've covered my points, and I'll ask Leslie to come up next. Thank you.
Thank you, Shannon. So just really briefly, again, because we want to make sure that we get the Reeb Center staff out of here on time, here's how this is going to work. We're going to do a panel discussion. We've got several leaders and experts here. So Community Shelter Board is represented on this panel. They are leaders in homeless. Mount Carmel Street Outreach Team is here to provide some perspective on the efforts that they are doing. We also have Mary Haven and the Columbus Public Health Harm Reduction Team here to just kind of talk about the addiction issues that are typically associated, as well as Community Development for All People and the Open Shelter are here as our local service providers. And we also have Safety, or represented here by Columbus Police. What we're going to do is we're going to have each of these individuals just go through a real brief kind of, here are some resources, here are some activities, just making sure that we all have that information. I am going to ask you to hold your questions during this time so that we can get through that, and then we're going to devote the majority of the time to an open Q&A session here. So we have a mic in the back, you can come up, you can make comments, and so, and then we can kind of have the discussion that way. So we will get into kind of some ground rules there, but obviously, just kind of remembering that, we all want to be able to have a chance to speak, and so we're going to try and keep things concise and brief, and make sure that, we are really driving towards solutions, okay? All right, so with that, I am going to have Shannon start us off again with just kind of talking about the current demographics that we're seeing and some facts and figures to kind of frame the conversation.
Okay. I didn't explain exactly what the Community Shelter Board is. The Community Shelter Board is responsible, accountable for a coordinated system around homelessness. Likewise, we are equally as accountable for delivery of services, the coordination of those services around those that are also either unsheltered or any levels of destabilization that are moving towards homelessness. We are ultimately the umbrella for not all, but for most of the nonprofits that coordinate care for those that experience homelessness or need any level of service delivery for that. We are the funding source, the arm of that. For some, probably the compliance arm as well. We're the heavy at times. But what we do have the ability to do is to recognize the gaps and then fill them, fill the needs for them. We don't, and we aren't safety necessarily, although we can help to organize that if that's a gap. We don't necessarily do things of the collective use of the city, although we're partners with that. But what we are responsible for is that if you see people that are living on the land, if you see those that are moving and experiencing levels of destabilization moving into homelessness, we coordinate the services for that we're responsible for. I hope that as we move through this hour and a half, that will become more clear about what we do, how we work with partners, and then what some of our partner agencies who we say are on the ground do as well. So a couple of facts around homelessness. This is probably not going to be necessarily new to you, but these are the things that we collect. I think you all know, you can experience it without the numbers, that homelessness is increasing. You probably know that. Those who are living on the land is increasing. You probably already know that. The numbers bear the exact same fact. There's 7,865 people staying in homeless shelters in Columbus. That was last year, and we know that it is increasing between 22% and higher each and every year. In that number, we have close to 2,000 children in the shelter. Many of you know and have seen Mount Carmel. They do our street outreach along with some other partners. They've worked with 550 plus households that are living outside or in places that are not meant for habitation. 71% of those in shelter, it may not surprise many people here, it didn't surprise me, 71% of those in shelter are African American or multiracial compared to 25% of our population. The average age is 43. The average income of those in shelter is $589 a month. 58% have a self-reported disability, and that number is increasing each and every quarter. The recent changes in the demographic is that 50% of our single adults cycled in and out of the shelter in a year, multiple times. The number of people from this neighborhood who seek homeless services is nearly 1,700 people. That was last year, and again, increasing year after year. 734 people from zip code 43206, and 964 from zip code 43207. You may be asking, why is this becoming more visible? And I think that some of us know that everything is blamed on COVID, so I'll say that first. COVID allowed us to know, and we know this, release dollars into the community, into families, and maybe some of you all had that, and we know now that those things are being dried up. And that families can no longer make the gap that was met anymore met, and the two ends just don't meet. And then if you move through a crisis episode, losing a home, a medical issue, your children, a parent, it can immediately move you into destabilization and then homelessness. We also have a waiting list for our shelter that is increasing year after year, and it is the highest it's ever been this year. Single men and women during the non-winter months are the most that are on our shelter list, with families being moved into hotels and motels, which we do pretty quickly because of our commitment to children. The average daily list as of last year was 93 people. And then finally, unsheltered homelessness is increasing, and you'll hear more about that later. Finally, I'll tell you that homelessness is not a crime. It's a human condition. It's fragility that we all bear. There are some other things that we'll talk about that potentially keep communities unsafe. But I just want to say and ground that to be homeless is not a crime. I'm going to ask, do I ask? I'll let Leslie take over.
Okay. So next we are going to hear from Steve Skowinski about point-in-time count trends and unsheltered homeless in more detail.
Yes, thank you, Leslie. So Shannon talked, so my name is Steve Skowinski, I'm with Community Shelter Board, and Shannon talked about the increasing number of homelessness, increasing number of people experiencing homelessness in the community, and I wanted to talk just for a minute about that and unsheltered homelessness, some of our strategy, and then I'm going to pass it to the colleague from Mount Carmel to really talk about the work on the ground. But every year, HUD mandates communities to conduct a point-in-time count, and that is to literally count every person in the community that experiences homelessness. And for people that are in shelter, that we have that number because of our database. But for people that are sleeping outside, we have an annual count where people go out to the camps, to people sleeping in cars, to people sleeping in parks, and we have teams that go out and count folks and engage folks. And Shannon talked about unsheltered homelessness increasing from 2022 to 2023, we saw that number increase by 46%. So there was a very big increase in people unsheltered. We saw the general number of homelessness in the community increase by 22%. So these numbers come from the annual point-in-time count. It's the last 10 days of January. This count will be conducted again this coming January. The date is January 25th. I've actually sent out the registration flyers to members of the community, Dee and Commissioner Welch, and a lot of people around this area. So look for that flyer to go out. We would love people to volunteer and really get out into the community and be part of that effort. So I really wanted to talk about the point-in-time count briefly. Partner agencies and locations in this community host us every year. Shelley at the Open Shelter always hosts us to complete surveys. Our friends here, our host tonight, the Reeb Center, we want to come here and do the survey. So there's many areas to volunteer. Community Development for All People is a site that can do the surveys for the count. So wanted to really note that and would love involvement, and there is no greater way to engage than to be out there at 6 in the morning when freshly fallen snow is coming down and you meet someone who's a survivor and who's in a tent and you're talking to them and hearing their story. So I really wanted to note that. I also wanted to just speak very briefly about some of our high-level view of our plans for this winter. So we have already begun the increase in beds in our traditional shelter, and that's our annual winter overflow program. The Van Buren Center adds the majority of beds in the community. Faith Mission adds some beds. Maryhaven adds some beds. Friends of the Homeless adds some beds. So we add these traditional shelter beds to make sure no one is outside during the winter or during the cold months. But we're also working on a new strategy to really engage people who have been reluctant to come into traditional shelter for a variety of reasons, for trauma and just the barriers that people experience. So we will be opening some additional beds, and in the South it'll be in the form of hotel rooms to really engage people who have been reluctant to go into traditional shelter. So in addition to the general overflow, we'll be working with a couple of hotels. It's the German Village Motor Inn and I believe the Cozy Inn down on South High Street. As two places we'll be renting some rooms to make sure people can get out of the elements, out of the cold, prevent anyone from freezing this winter. So I really wanted to note that. And a big component this year is we will be merging Community Development for All People will be providing the operations. Then we're working with our friends at the Coalition for the Homeless and at Maryhaven to provide services. So it's not just a place to get out of the cold, but the goal is really whatever part someone is in their journey on, we want to engage them around connecting to services and rehousing. So that's a big goal of this year's warming center plans. And last, and I just want to pass it over to Matina. She's going to talk about Mount Carmel's strategy of addressing street homelessness. There was a remediation that occurred about 2 months ago, perhaps, where we engaged folks that were at the Marion Wagner encampment and really had a multidisciplinary approach. It was Mount Carmel, it was PATH, it was the VA, Huckleberry House, Maryhaven, and really worked to get people who wanted to go inside into shelter, into hotels, and even into treatment. So just kind of wanted to note that that is a strategy we have and we carry forward into addressing other community encampments, is that multidisciplinary approach and access to housing and shelter. So, Matina?
Hi, I'm Matina. I'm with Mount Carmel's Housing Outreach Team. So our role is to provide housing case management services and resource connections to people living on the land in Franklin County. And so what that kind of looks like is us going into the community and meeting with our unsheltered residents, trying to provide support for them, whether it's, connection to food resources, starting to work on housing, medical resources, things like that, and then completing paperwork with them to get into permanent housing. So what that process looks like is about 6 to 9 months from when we initially meet with someone and begin the housing paperwork to when they typically move into housing. So it can be quite a long process, and for a lot of folks, they'll continue to live on the land during that entire process. And specifically on the south side, we have a Mount Carmel street medicine clinic that happens every Tuesday at the open shelter, which is like a really wonderful way for us to get connected with folks. Our street medicine team has caseworkers, and the nurses there are great about getting us connected with people who are coming in for medical services, getting them connected to our housing caseworkers so that they can work with us to get into permanent housing. And then we're also just in the community doing outreach, meeting people in the area. We were really heavily involved with the Marion Wagner camp and are still involved with them as they're in transitional housing. But I'll be transparent. The need for these services is growing, as we've discussed. The homeless rates keep rising and rising year after year and quarter after quarter. And so the need for these services is huge. And we're not an endless supply of caseworkers, but we're doing everything we can to meet as much needs as possible in partnership with the Community Shelter Board. They're very supportive in trying to meet that growing need with us. Something I kind of want to touch on is that people who are experiencing homelessness are some of the most marginalized and vulnerable people in our population, and you are significantly more likely to experience crime the more vulnerable you are. So the reality of that is our unsheltered residents are experiencing crimes at way higher rates than our housed residents. And so what that looks like for like our team, our partners, is that we have to be mindful of these things when we're working with our unsheltered community members. We have to be compassionate, we have to be patient, we have to be willing to listen, try to get them connected to places they need, and understand that they are in survival mode, they are in crisis mode, and they're experiencing trauma at significantly higher rates than a lot of other folks in our community. So with that, like with being neighbors with unsheltered folks, as all of us are, if you live in Columbus, you have an unsheltered neighbor. And on the south side, there are a lot of unsheltered neighbors that we have. And even though they don't have a roof over their head, they're still our neighbors. So trying to build those relationships with them is extremely important, even if you don't have anything to offer at that moment. Just introducing who you are, trying to get to know them. If you are able to offer something like a cup of coffee or a sandwich or like a blanket, that's huge. Because building those relationships, you're going to foster more supportive neighborhoods. And that is kind of how we can, I think, collectively as a community, be there for our unsheltered neighbors and not just be, someone who's calling in a 311 ticket because they're frustrated that there's someone sleeping on a bench near their house and they're concerned, but like also trying to, foster those relationships that you can have supportive relationships and healthier neighborhoods.
Okay, let's move on then to Adam and with Mary Haven and Andrea Boxell with Public Health.
Good evening. My name is Adam Rowan. I'm with Mary Haven. We are an alcohol, drug treatment, and mental health provider. We have a facility on South High Street, not far from here, at South High and Jenkins. That's called the Mary Haven Addiction Stabilization Center. I'm here tonight to talk about the availability of treatment resources for addiction. So I think it's important to note that when people are ready to engage with treatment, one of the key factors for that is that they can get treatment at that moment. It can't be, well, maybe I can come back in 2 days. It needs to be that it's there at that time. And so I think it's important to talk about that at our facility on South High Street, we are open 24/7 for walk-in treatment options, okay? These are low barrier walk-in to service. That doesn't mean that making the decision to enter treatment's easy and that it's not sometimes scary for individuals, but I do think that it's part of the conversation among the resources at this table that that there are options available and that we can be coordinated to help people who want treatment seek it.
Thank you. I also want to say thank you. I want to say thank you to each of you for allowing us this space and this opportunity, because I think when you're given these opportunities in this platform, we can deal with myths and misinformation. So one thing I want to make sure to express is how do we, Columbus Public Health and the Columbus and Franklin County Addiction Plan, engage with individuals? The first thing is we have to start with building rapport. If I walked up to any of you and said, I need to see your ID, I need to know your income, I need to know your history of how you got here, you would naturally say no. Despite me saying to you that I work for the city of Columbus, I've worked for the governor, and I've worked in federal government. And why? Because you don't trust me. And here's the thing, I treat everyone the same. So if I'm dealing with a person who is houseless, if I'm dealing with a person who has the disease of addiction, I make no assumptions about our relationship. So I have to build from there. So what do we do at the City of Columbus? We've started the Walk-In for Recovery. We've partnered with many of you in this room and on this panel and said, thank you for giving us forum. The more often we're at your agency and in the community, the more likely it is that someone's going to trust that, okay, they didn't just come and go. They stuck with it. They're not just handing down and handing out. They're standing in the trenches with me to come up. The other reality that we deal with is I need you to understand the system of care and the issues that we're currently dealing with are systemic issues that are over 100 years old. So for us to think a conversation about, well, I just need to get insurance, yeah. But there are also private agencies that can say, I don't take your insurance. You don't have an ID? I can't open up a chart for you. As much as a person goes to an agency and says, I want treatment at this moment, if you don't have ID or proof of residence, how do I know who I'm billing to? So there are a lot of systemic issues that are in place, and what we try to do when we come out to the community, along with our partners, is to say, okay, what is it that you need a birth certificate? Oh, wow, you weren't born in the state of Ohio. Do you know how much it cost? Who's going to cover the cost to get you that? So we try to collaborate with our partners across the board to look at each individual, each situation, just as we would with each one of you to help make sure your needs are met. Thank you.
Thank you. All right, now I'd like to turn it over to our local service providers. So Mike Primo with Community Development for All People and Shelley Mathias with the Open Shelter. So please talk about your work.
Good evening, everybody. I'm Mike Primo. I'm the Executive Director at Community Development for All People. I want to start by saying something that might be a little counterintuitive, which is at Community Development for All People, we focus on what's called asset-based community development. We don't focus on what's missing or broken or lacking in a community. We focus on building a positive vision and assembling the assets to make that a reality. And we see every single day that people experiencing homelessness are an asset to our community. They volunteer with us, they help pick up trash, they help us in the free store, they help us in the fresh market. They're always looking for ways to be part of the community, and they do have a role to play here in the work that we do. So we're very grateful for their presence here because they are part of this community. And some of them have been here a lot longer than I have, and I'm a resident here on the Southside. So, but I want to talk about the fact that, you know, we and others recognize that there is a growing number of people experiencing poverty and homelessness on the South Side. So rather than sit back and just wonder what to do, we actually came together, a group of us, and we have a monthly stakeholder meeting. Dee Davenport and I co-chair it, whereas Sarah from Southside Thrive helps facilitate the conversations. And it's this really unique coming together of people from different backgrounds and experiences, landlords, tenants, business owners, nonprofits, community members coming together to focus on that positive vision and assembling the assets to make that a reality. It's an incredibly diverse group, and we've already had some remarkable successes in that. Number one, we were able to get CODA to finally focus on enforcement at the bus stops. And so we're hearing from the community members and business owners that they are feeling a greater sense of safety on Parsons Avenue and a greater sense of safety throughout the South Side. So, and I also wanted to speak for a moment about the warming center because, as Steve mentioned, CD4AP is going to be operating the warming centers on the South Side. We've been doing this for years. And in the past, it's been a night here or there when it fell below certain temperatures where we could, and we just scrambled together a small group of our folks who were connected with us to make sure they had a safe and warm place to sleep. Over the years, we've expanded that. Last year, we were open for just under 2 months. This year, thanks to Community Shelter Board and the City of Columbus, we're going to be open for 4 months. And we're going to be providing a level of care and concern to people experiencing homelessness that we haven't been able to do before. We're going to connect them to resources in a way that we never have before. And so those folks in those hotel rooms are not just going to be staying there, they're going to get connected to resources, and we're going to talk to them about achieving their hopes, their dreams, and their aspirations for the community. building on our relationships of trust, because the greatest asset we have at CD4AP is the trust the community places in us, especially those who are experiencing homelessness. So we're able to go out and connect with them in a way that maybe other organizations might not, because they're not so familiar. For example, myself and Kim Harrison, our Community Connection Coordinator, and a couple of other staff were going out just around the neighborhood today, and we got about 30 people signed up to come in tomorrow and do the intake through Community Shelter Board so we can get them off the street and in a safe and warm place to sleep tomorrow night. So we're very excited that we're able to provide this opportunity for people and partner with great organizations like Open Shelter, Stowe Mission, Reeb Center in a way that we never have before, to talk about coordinating services and find a better way to serve the community. So I'm very excited for what's to come. I think this is going to be a great experience for us. We're going to learn some lessons this winter like we did last winter, and we're going to figure out a greater way to serve the community. So, Shelley?
Mike. I'm Shelley Mathias, and I'm the director of the Open Shelter. We're the new kids on the block, so I'm going to tell you briefly about the Open Shelter. We're a day shelter advocacy center for the homeless and marginally housed people in Central Ohio. We've been serving Central Ohioans for 40 years and have been in our current location for 2 years. The Open Shelter is privately funded, and we operate within the limitations of our budget. We meet emergency needs by providing a meal, sack lunches, food boxes, clothing, hygiene, and supplies for those sleeping outside in the elements. By providing these most basic, crucial needs, we begin formulating a trusting relationship that enables us to walk alongside our guests as long as they need us to. By design, the Open Shelter works with people who have a mountain to climb. We have intentionally stayed as close to the street and this population as possible. We measure progress in small successes, such as obtaining a birth certificate, and we do birth certificates for any state. My colleague has even done birth certificates out of the country. She's amazing. By obtaining a birth certificate, this opens up the possibility for housing, jobs, and assistance programs. At the Open Shelter, as of August 2023, we have seen a 30% increase in new guests registering with us from this time last year. And our encounters, so the one-on-one interactions we have had with those guests, has increased by 50% from a year ago. We are currently averaging 135 people daily. I did bring business cards with my contact information. We want to be good neighbors, so if anyone ever has concerns, questions, or you want to tell us something good, my contact information is on there. And all of our services, I didn't begin to scratch the surface of the services that we do, is on the back of my business card. Thank you.
Great, thank you, Shelley. All right, so before we start Q&A, I want to pass this over to Sergeant Danaher with Columbus Public Police Department, are there any kind of updates or responses to the recent concerns that have been raised?
I think the best way for me to start is to explain how the police department gets involved with homelessness and how it comes to us and maybe the public expectation. For the longest time, communities in America have always used the police or thought of the police as the hammer to address the problems of homelessness and drug abuse. And we find, after you listen to this panel, that the police aren't the people that need to impact this or aren't going to have the greatest impact. The greatest impact is coming from outreach and stakeholders. And that's the first thing we have to understand. Homelessness is not a crime. So when you call a cop and you sit down and you say, I want a homeless person removed, how would you like to be removed from a park bench? How would you like to be removed from a bus stop seat? How would you like to be removed from sitting on the sidewalk? Things that you can do legally, but because you don't want to see that homeless person, you call the police. And then you're not happy with the response you get. Remember, the police department is about law enforcement, okay? So if there's not a violation of law, the police department isn't there to take action because you're not happy with what you see or something that you don't like is in your community. The first way we get involved with 311s, or the first way we get involved with homelessness, is 311s. We get, in a year we get thousands. between my unit especially gets all 311 complaints for the homeless, as well as all the noise complaints. And it's my job and my boss's job to filter through these and sit down and see which ones we need to address. Some I send to Marcus Johnson because he can coordinate outreach. Some I send to code enforcement because they're code enforcement issues. Others I just send back a response that it's not a violation of the law. Sometimes I take a 311 and assign officers that work my unit, and I say, I need you to go out and take a look at this and address it. And a good example of this would be the homelessness around the railroad tracks. If you're from the west side to south side, if you have railroad tracks, I'm sure somewhere you're going to have a homeless issue, and you're going to have trash and debris and camps and things you don't want to see. It's railroad property. The city doesn't pay to clean it. Railroad is required to clean it. And if you talk to the city attorney's office, getting the railroad to take care of that issue in a timely fashion is something that just doesn't happen right away. Eventually, they'll take care of it. So that's one way we find out and have to deal with the homeless. My officers will then go out and they'll address the issue. Sometimes they can assist, but usually they contact some resource. They contact Marcus, they contact Code, they get a hold of people at the Pride Center to see if we can't get resources for the homeless. The idea is you're not going to rush your way out of homelessness. It's just not going to happen, folks. So get that out of your mind. The second way we get them is demands for service. When the public has a problem, you're a business owner and you have a chronic homeless individual that comes into your business and repeatedly steals or comes in because they're cold and they're just hanging out there, and you want that person to leave. So you call the Columbus Police Department and you say, I have a problem. It's called a 16T, a disturbance involving somebody who's trespassing. The police come not because they're homeless. They come because there's a violation of law that they can deal with. And that's how we get involved with most of this. The problem that most people have with the police when they say the police aren't doing their job, they don't do anything about homelessness, it's the expectation that you have. Private property is dealt with considerably different than public property. So if you're a property owner and you have a homeless person living in your backyard, you can walk up to that person and have the police there and say, you need to leave now. And if you don't, you could be charged with trespass. Now, on public property, it's handled considerably different, particularly like on land bank property or Wager and Marion, where we had that camp. We were aware of that camp, but you have to offer services to these people. What's the arrest going to do? It impounding their property and taking everything they have. It's not going to resolve the issue, and that is their homelessness. So get the idea out of your head that the policeman's job is to arrest homeless people or move them from your area because you don't like it. Okay. I'll be here after if anybody has any questions regarding how we respond to these, and the officers on the street respond differently than my officers. I'll be here to answer questions, and I think Officer Lutz was here, and I think he can provide input on that also. Thank you.
Great. Thank you, Sergeant Danaher. All right, so we're going to open the Q&A period. So if you have a comment or a question, let's start kind of lining up at that microphone back there. While we're doing that, I just want to kind of acknowledge we do have other expertise here in the room besides just the folks on our panel. So we have Tiara Ross with the City Attorney's Office, Sue Valillo with Adam H., we have Marcus Johnson with Columbus Department of Development. Stowe Mission is represented by Joshua Shortridge, and then obviously our Reeb Center folks, Ali Zoller, CEO. So with that, and again, this is really the listening portion of it, right? So we had information that we wanted to share, but we also do want to hear the concerns, and I have tons of folks here in the room who are willing to answer questions. So, please.
I have to leave. That's the only reason I'm jumping ahead. I apologize. My name's Heather Fitzgerald. I have worked with homeless folks here for 11 years. I have Gold Heart Outreach. I do camp outreach. And I I think one of the only people that give people rides to warming stations, like we'll pick them up from anywhere, make sure that they stay warm. My question is, I guess it's a statement and a question. Have any of you ever sat on a panel with unhoused folks? Like, have you ever sat at that table with unhoused folks? Because we're sitting here, I've been to so many meetings like this over the years where we're all talking to each other, and I appreciate I got so much info tonight. But there should have been unhoused folks on this panel tonight. They know what's best for them. They could have explained to us more about what's actually going on in the camp. I don't want to hear from you, no offense. I appreciate your time and everything, some of you have done some great things for my people. But I and many other people are the ones that are on the street with the folks. And I just don't think that, my thing is I never feel like most of you truly understand. You read it in a book, you talk to people, you go to the meetings, you hear, but you're not there every single day. And that's just, it's a very different perspective, and I just urge you to do that. And then Sergeant, thank you so much for explaining. I just want to say for talking about how, the police are not, I appreciate that that's your perspective. That is not my experience. I just had a dude 2 days ago that the officers came through his tent down into the ravine. He's on railroad property. But they did that. I saw it happen right in front of me. I had just given him blankets, everything. Now all his stuff's gone. It's 18 degrees that night. This is still happening. So I urge you to please, I wish everyone was like you, is my point. That's all I have to say. I just, please next time, have unhoused folks on your panel. I don't want to hear from you. Thank you, though. I respect you all. Thanks.
Thank you, Hannah, for that perspective. Who's next? Please.
Can I answer the question?
Oh, was it a question?
Yeah.
Okay,
Question.
sure.
I think it's important to be transparent. I think, let me answer her question. I think she had a call to action about it is important for people to be represented who are experiencing and living and moving through conditions. And I think that is a call to action that I want to make sure that I'm not glossing over and that we're taking a minute to pause to hear the request. So the question is, have you ever been on a panel with homeless people? I certainly have been on a panel with many people that have moved through levels of human condition, including domestic violence, the murder of their children, murder of their parents. I come from generations of alcoholism, prostitution, beatings, poverty, single family, single mom, generations of poverty and disinvestment and disenfranchisement. I think it is important, though, that we definitely hear from people who have lived experience. And although that I come from levels of poverty, I really never experienced it because I had grandmas and great uncles and cousins all around me, surrounding me to make sure I was okay. And that's the issue, safety. So I want to make sure that I'm clear about what I'm representing. I'm not representing anyone with lived experience. You don't have to listen to that part. But I am representing someone who has to make decisions. And you have to hold me accountable for that. It's important that you know what I look like, where I am, where I sit, where I work. It's important. And so I don't want to gloss over that representation matters. If you look at me, you can see that representation is needed. I'm a black woman. So I get it. But I haven't lived it. No, I've never been homeless. But I've been poor. So I want you all to know that about me so that the call to action is heard, it's landed, I hear it, but I wanted to make sure that I answered to it.
Hi, I'm Sherry Palmer. Worked for the city for 14 years and now reside in Southern Orchards. First, I do want to acknowledge and thank each and every one of you on the panel because what you do every day is very difficult. It's very emotional, and it's burnout city very quickly for all of you, and that's understood. I also want to say that we don't want to assume that the people who are homeless are necessarily have always been at poverty level. I personally have known high-powered individuals who have fallen off the radar, mainly because of addiction issues, and have ended up on the street. And it is a crushing situation to see people living in a car and not having many choices. I've had neighbors, and I'd say most of us here on the Southside understand that we are diverse neighborhoods. Many of us know and speak daily to those people who walk down our streets, who are genuinely talking to us and wanting to engage. So, with that said, our group, which is started by Dee Davenport and Mike, came about because not so much as the officer said, we didn't like what we saw, but we saw violations of the law. We had numerous problems and issues at the corner of Whittier and Parsons with open container and alcohol, and panhandling that came into a safety issue where people were actually pounding on vehicles and going into the street. Those were our concerns. Our concerns are also that we want a revitalized and safe, both perception-wise and reality-wise, commercial corridor of Parsons Avenue. And for that, it is extremely difficult to see people sleeping on the street every night, knowing full well that we have an abundance of services. And I also know many people don't want to be in the shelters, and I know those reasons. It's difficult. If these individuals also have day jobs, it's difficult to make that list, to get in, to have a bed. Bottom line, we on this group are trying to look at solution-based ways to work with the homeless issue and also bring the economy back to Parsons Avenue. And yes, many of you know me, I'm a flower diva, so it's not about planting flowers, but it is about bringing people into the community that want to work, that will take over abandoned storefronts, and hopefully we can make use of the talent that Mike has money for to help us pick up litter. One of the biggest key problems is that we are a service-based Southside, and we feed the people, but we're not responsible for their use of the food afterwards. The trash and litter problem is absolutely enormous, and that is because if people are fed, they're taking food out of where they've been given, they're eating maybe some of it, dropping the rest of it either on the ground in our neighborhoods or overflowing the trash containers which are on Parsons. What does that lead to? That leads to the health department, a big rat problem. And I live next to a very, very smart individual who was a hoarder, who fell on hard times, utilized the fresh market, but I saw what one individual could do to a community by bringing hordes and hordes of fresh food and putting it on the porch and let it rot. And I suffered for 2 years with batting rats, I'm sorry, this is animal abuse, but batting rats over the head and all the other issues that went along with it. So I'm saying that we need solutions to that. We want to know how to help when we're trying to give food so people aren't hungry, but how do we make them responsible, and also to get the city's help in doing more to solid waste inspection in our alleys of dumpsters that have holes and are causing the rat problem. So again, we want solutions, we want positive results, and thank you all for your time.
I just want to thank you for raising one thing that I think is really important, that when we're looking at issues surrounding homelessness, when we see people who are experiencing homelessness, basically, unless you flew here tonight on your own private helicopter, that could be any one of us. If we lose our job, if we have a health crisis, if there's a death in the family, any number of things, addiction or mental health issues, that could be us. Right, so and there's another thing that I like to say to folks who don't have a lot of experience working with people in poverty or experiencing homelessness, which is there may have been a time in this country, I'm not saying there was, but there may have been a time in this country where people could really work hard and pull themselves up by their bootstraps, but it is nearly impossible now because the system has been so rigged against people experiencing poverty and experiencing homelessness that it makes it very difficult. Things like that were identified issues about lack of ID, how expensive it is to get in. We see these issues all day long. Helping people overcome these systemic barriers is far more challenging. So I really appreciate you raising that issue because it's an important perspective for people to have, that it could be any single one of us at any time.
If I can, you asked for resources, so I'm going to give you a couple of resources because I think it's vital. You brought up getting the birth certificate. We have countless events. We will set up, I know that I just heard your organization and your organization offer them. When we do our walk-in for recovery, those are free. That's a $25 option, right? The other thing that I think is so important, and I sat here struggling to say it, first of all, absolutely, I've sat on a panel with people who are homeless. Absolutely, we serve people daily who are still houseless. And sometimes their voices aren't heard because they are ashamed, they're stigmatized, and they don't feel comfortable. So I have to take my job, my platform very seriously to take their voice and speak for them. It doesn't lessen the message. But we will give the opportunity. I heard that loud and clear. Absolutely. Give them the opportunity to make an informed decision, making sure they understand who they're going to have to sit in front of and what the response may be. We're not looking to traumatize or re-traumatize individuals. The other thing that I think is important to understand, especially when I work in the criminal justice system, and I hope you can draw the parallel. Never assume that people who go to jail are being rehabilitated have ever been habilitated. So in other words, when you look at the options that we give, if you look at the national data on homelessness, the number of people who were homeless throughout childhood. So assuming that everyone knows how, and I've gone through this, when I had the specialized dockets, and I'm just giving you an anecdote, we had a woman who had been living by the railroad tracks, as you so aptly say, for 5 years. She knew how to keep her community safe. They had somebody who was like a landlord. When she came into the mental health docket, got on her medication and said, I definitely want to go into housing. The moment she went into the shared housing, she was upset because somebody was running a blow dryer at 5 a.m. to go to work. And she said, how is that fair to me? I should still be able to choose my housing and to choose what's safe for me. And this whole idea that you're putting me into a circumstance and situation that I haven't been in for 20 years and think I should appreciate it and you should expect me to jump and know how to deal with it is not fair to me. So a lot of times when we house people, we have to take into consideration where are they coming from, what is their history, what is their trauma, and we as social service providers are not looking to re-traumatize, nor are we looking to exploit, and that's very key. So for resources, I'm going to ask you to do this. If you're on the Facebook or the TikTok, you look up the Instagram, you go to the Columbus and Franklin County Addiction Plan. This reaches across 75 different public, private, profit, faith-based organizations, and we list all of the activities that are happening in our community, including getting a free ID, getting a gas card, getting diapers, getting tents. And some people will tell you, and then I'm done, well, if you give them a tent, you're encouraging homelessness. I can tell you as a diabetic who ate a Snickers today and had my shot this morning, nobody encourages my diabetes. We don't encourage homelessness by giving them tools to survive.
I've always wanted to be on a panel with Andrea Boxall. No, I want to say just really quickly, rather than a person with lived experience being on this panel telling their story to a large group, on the Parsons Avenue stakeholder group, our work group's recommendation into the next meeting was to bring people with lived experience into that meeting to be part of those work groups.
And before we get to our next speaker, I do just want to kind of acknowledge, so on the tables you do have little resource packets that we have assembled that have some of those basic resources. You may be familiar with them already, but good to have a pocket guide. And then certainly some of the questions or concerns that are raised here, such as the litter and the sanitation issues, we're not necessarily going to be able to address those right here, right now, but I do want to acknowledge that that is heard and, you know, something that we will be discussing with the appropriate departments, okay? All right, sir.
I'm Gary Whittier. I'm a retired clergy person. I want to bring up a topic that I'm not hearing a lot of. I want to say that I was the first director of the Open Shelter back in 1981. And the problem still remains, and it's gotten worse. But I see that around the country, people are talking about tiny homes. That is a solution that we need to be looking at and having conversations about. And I don't see that happening in the city of Columbus. If there is, I'd like to be invited and be part of that conversation. Tiny homes has worked in other communities, and are we checking this out? Because quite frankly, shelters and warming centers are not the answer. Housing is.
Okay, one response here real quick, Sherry, and then, yeah. So Sherry Palmer is sharing that there is tiny housing starting at the, where did you say? Eastland Mall. Okay. Okay, so we're going to get some follow-up information on that. Shannon, did you have another?
I think, yeah, there are private companies that have started a tiny home. I have researched it very directly, and I'm still not resolved that it doesn't make, by square footage, our rents go up. And so before I get behind something, I need to make sure that I am not hurting communities down the line. And I have not had that part for me resolved. I want to, though, echo very clearly what you said that I think needs to be echoed, is that we have a model that housing should be first, not shelter, housing, and that needs to be the expectation within this community. We have to get out of the mindset that we shelter and we shelter and then we shelter and then we shelter again, because what we're really doing is housing for a long, long time. I would like to see some options on housing, but it has to stay affordable. It has to be for poverty housing. People are allowed to be poor, people are allowed to be middle income and keep their housing. And I am not sure yet, outside of the very private companies that can afford it, if the rent and the subsidy to keep that very tiny square foot home would not rise up the rent for other homes in communities. So we could, sure, of course. Sure, yeah, I will. We can talk about,
Absolutely,
yeah.
good
Okay.
point. And again, some of this stuff we are collecting. It is very important, again, that you sign in and give us your email address, because I do expect a follow-up email to address some of these things that we weren't able to address in the room, okay? Ma'am.
All right, hi, I'm Sarah Lenke with the Southside Thrive Collaborative. Appreciate all your work. I think my question's for the shelter board and maybe the systemic approach, as the numbers are much higher right now of people needing housing supports. We know the affordable housing need is there, plain and simple. So what is the thought around the plans as we expect the need to grow, both for immediate support, people that need that, as well as the outreach in the communities to just engage people and get them some initial connection?
I have a 7-pronged approach that I have presented forward with stakeholders informing it. I'll give you maybe the top 3 of those 7. The first is I think that we should move towards net zero homelessness for families, and that includes pregnant and expectant mothers. I think we have the ability to do that because there's enough partners within the space that are able to pull the levers together to synergistically do that. We're going to need money. I think, though, that we have the right partners, big partners, AEP, for instance, the foundation. We have big partners that are interested in doing that. Prevention. That's also part of that same strategy. We know prevention works, but we got to go upstream for prevention. We have to know before someone loses their home, that they become destabilized, that we have to keep them there. And what we also know from the pilot is that when we use the money correctly, it ends up helping the best cohort it ends up helping is women with children or expected children, up to, we've seen numbers as high as 91+%. We don't see them come into the system. So that's one strategy. The net zero homelessness for families, it means a couple of different things, that we can take children, a lot of children. Van Buren has up to 270+ children on any given night in their shelter. We can take children out of the shelter system. 0 to 5, we know that once you're there for 6 months, it changes your fight or flight, and it's hard to get corrected. So we can do that through a couple of ways. I'd like to do some hotel-motel conversion, not necessarily popular, but I think that we can do that and start transforming some of the very empty spaces that we have in the Midwest and moving it to some housing, maybe the small housing in which we're speaking about. So prevention, motel, hotel conversions. And then I would like to deploy a tool that we don't use really well, but we have it. We have funding for it. We have money, which is rapid rehousing. But rapid rehousing means that we have to have housing stock. I do think that we have underutilized housing stock here. We don't talk about it a lot because people are excited about developing new housing. But I do think that we have underutilized housing stock that can be used, that for right now can move people out of the shelter directly into housing. That's one big strategy. The second is I do think warming centers will start organizing communities in benevolence again. It is important to have rec centers and community centers that take care of our most fragile. We talk about it through homelessness, but there are people who are in homes that use their ovens to heat their homes. There are people that need rec centers, community centers, benevolence of community within spaces. And that the warming centers can warm, they can cool, they can respite for our kids when parents are away and working and kids are on vacation. And then what Community Shelter Board can do is if they need people need to sleep, we can find a different space for that. But warming centers, I think, are also crucial in moving out of this mass movement of people going away and out of their communities to be helped. Thirdly, I think that we have to pay people more. Don't cut off my mic when I'm talking about paying people more. We got to pay people more. We have to pay people more. We are losing our most talented people. They're going into case management, social work, and they're helping partners here. They're young, they're out of school, and then by 4 or 5 years, they're exhausted and they leave. And they're tired and they're poor. And they can't pay their student loans. So I say, let's pay people more. Let's stabilize what I'm calling a safety net, a first responder system called homelessness. And then let's make sure that we have a retention of talent that then can start thinking about when they're 10 years into the system, when they become Mike Primos, to really start talking about how do we start changing and giving solutions, long-term solutions for this issue. We have a hamster wheel now, and we got to stop that. There's other things that we have, but I think those are the top things that we can do.
I'm usually reluctant to follow Shannon, but I'm going to attempt this time and to say that one of the things that I love about the Southside, one of the things that attracted me to live here, and one of the things I've been most gratified is the incredible diversity here, and that we have to embrace that as an asset and show the rest of the city, the state, the country, what it looks like for a community to say, instead of not in my backyard, to say yes in my backyard. Yes to permanent supportive housing, yes to transitional housing, yes to workforce housing, yes to all of these different things that will help get people off the street and stabilized, and then off on the path to getting a house of their own, a key of their own. Because I got to tell you, as somebody who's talked to a lot of people experiencing homelessness, I have never talked to one person who said, you know what, I'd rather live on the street. They'd rather maybe live on the street than go into a shelter, but no one I've ever said was, no, I don't want a place of my own, a key of my own, a place to store my stuff. And one of the great things about the Southside is that we have embraced this, that there are people of middle and upper income living right next door to people of lower income. There are white living next to black, gay next to straight. It's a beautiful model for the rest of the city, the state, and the country to follow. And I think we just need to lean into that even more as we enter this next chapter of how we get people off the streets.
Thank you. Thank you. All right, sir.
Hi, my name is Joe Motil. I'm a homeless advocate. I work primarily with Here to Serve and First Collective. And I've several things I want to just touch on real quick, try to anyways. Transitional housing, as my friend Reverend Whittier spoke about, I think he's talking about tiny homes, transitional housing, small ones, 100 square foot, wraparound services available at these lots, maybe 25 to 30 or something like that. This formula has been used across the country. You all are well aware of it. There's a lot of successful ones out there. It needs to be done. If we can, municipal ID, I've heard two people mention it now. I'm sure many of you are well aware of the fact that the organization BREAD has been in the city's face for 8 years now, since 2015, to create a municipal ID program. Where is it? You're all complaining and saying we need IDs. Let's do it. It's not that expensive. If we're truly going to help these people, if they need an ID, we need a municipal ID program. New York City, Chicago, I believe, large cities like this have it. You all have the ear of our city officials. I know that. So let's see if we can finally get this done. 8 years is too long to get a municipal ID program in Columbus. If we can get $54 million to the North Market, to developers, we can sure as hell find money for a municipal ID program. The other, warming centers. I know Mike has one available. It's going to start up pretty soon. Where's the other ones? We can't have just one in the city of Columbus of 900,000 people. Are there going to be more warming centers? Where are they? Okay, we had 3 of them last year. 2 of them were a disaster. You all know that. They didn't work out very well, the one especially on campus. So what are we doing about warming centers? And can't the sweeps. Okay, somebody talked about trash, litter, things of that nature. You all know why our homeless encampments are trashed, okay? Because they got nowhere to put this stuff. Why can't we provide 10-yard dumpsters near these encampments that are serviceable? As long as they're serviceable and porta-johns, so the conditions aren't so bad. How expensive is that? As opposed to spending hundreds of thousands of dollars to do sweeps, why can't we afford to do, porta-johns and also to provide dumpsters, roll-away dumpsters? That's not that expensive. There's a lot of things. We talk about being a progressive city. We are nowhere near progressive when it comes to addressing our homeless in this city. So it's time that we start doing something about it and stop talking about it. Thank you.
Thank you. And Steve, correct me if I'm wrong. Do we have the list of warming centers yet, or?
We do, yeah. We have a list that is daytime warming centers that are going to be options for people that just need to come out of the cold. And then we're working on getting out the list that there's going to be an east side and a west side overnight warming center.
Okay.
So yep, we'll be getting all that out.
Okay, so information forthcoming on that, wherever Joe went. Okay. Ma'am.
Marty Grace, and I'm with the Southside Area Commission with Dishler Civic Association. And I've sat here and listened to all of this, and I still am not hearing, any type of solutions. The warming stations are not going to work because I sat right down there in City Council and heard them talking about closing your center because of the violence. So it's obvious these warming stations, or whatever you want to call them, are not feasible. We have all of these vacant lots around the city because I went out and I started looking for some to build homes on for a friend of mine that was trying to get the city to help him put up affordable housing, which he was saying a 1 or 2 or 3 bedroom apartment would cost people $400 a month, but they wouldn't listen to him. Okay, why don't we take these vacant properties that you got all over the city, put up some housing, and let's stop talking about homelessness and not ever doing anything about it. And as far as the warming stations, they probably help at night. But what about when it's 10 or 20 degrees outside during the day and you get thrown out of those warming stations? So warming stations is not the answer, and to me, it's a waste of taxpayer dollar. Now, I live on an acre of land, and in fact, I would be willing to give up some of that land if they want to build a home on it. But I don't want to hear any more about warming stations and all of that because it's not working. And it's not helping the people that needs help.
Yeah, let's do some clarification on these warming stations too, because we do have daytime ones, correct? Okay.
Community Development for All People, we have operated, as I said, a warming center for many years. They are not a long-term solution, so I agree with you on that. We need to get people into homes. We need more affordable housing, and we need it right away. So absolutely. But in the meantime, the warming stations do serve a purpose, and this year our warming centers will be open 20 hours a day, as opposed to last year where we were open just overnight. So we are learning from experience, we are building, we are getting additional resources, but the main thing is, during the winter, we're keeping people from freezing to death on the streets. And that's what we've been doing for many years over at CD4AP, and now with increased partnership with other agencies, we can not only keep people safe from freezing on the street overnight, but we can also get them connected to resources. And I also want to say that one of the greatest badges of honor that we've had over our years when we've operated the warming center is that when you walk into our warming center in the middle of the night, what you hear is people snoring, because it means they are safe and they feel safe enough that they can actually get that deep, restful sleep that they can't get when they're on the street, when they have to sleep in a doorway with one eye open to make sure they're not being subjected to violence. So I know that other places have experienced other issues. I just want to make it clear that was not the case at CD4AP. Our folks, our community members, and there is no greater asset than the trust our community places in us. And we would never want to put our people in a position where they were unsafe. But our warming centers are doing the job of at least keeping people safe and fed during the winter months, the coldest months of the year.
I just wanted to add, I hear the frustration in your voice, but every day when I wake up and drive to work, I believe that I'm helping people that are homeless. I really do. We are patient, we listen, we care, we love, we cry with them. We're happy with them when they get housed. They come in with hurdles that need to be jumped and barriers, and we, through lots of partners sitting at these tables, help them over those barriers. I hope that you will come to the open shelter, get on our website, look at our Facebook page, and see the work that we're doing. We really, we love working with this population of people. They are incredibly grateful and respectful, appreciative, and you know, we work really hard to help.
I think everyone here is certainly in agreement with that, and I think that, you know, it starts to get down to priorities and then certainly stopgap measures, but wanted to make sure that we definitely hear that. All right, so we're gonna move through this real quickly here. So last one, make sure you're speaking into, or not last one, I'm sorry, but next one, but make sure you're speaking into the microphone for us.
No problem. My name is Letha Pugh. I'm a small business owner here on the Southside. I've been on the Southside for 9 years. We love it here on the Southside, and it wasn't until I went to Whittier and Parsons. We've got to give each other some grace. I can say that because I also have Cafe Overlook, which is a workforce development project, and we remove barriers for people. And we deal with a very small sliver of people, 30 people at a time, and we intensely dive into their lives and try to get them on the right track to get them to a better job, and housing is included in that. I am a process person, and I've only been here at this corner for a year, and you may see me picking up trash out there. You may see me out there talking with people. I don't want to erase the people at Whittier and Parsons, but I want better accountability from the services that they've been providing. If I've only been here a year and y'all have been here a lot longer than a year, I'm trying to understand how we not better meshed and how we not communicating. Okay, well, if you do breakfast, then I'll do lunch, or we gotta be better. We gotta be better. And I'm not trashing you, because I'm also saying I will show up and help. So I come to the meetings at the library. I try to pull together the little resources and connections that I have. We all have to help, y'all. All of us. This is not us against them, or us against the people who are unhoused. This is, how can we do this with some balance and some love and some money? Because the first thing I think is, when I drove down here tonight, I drove by an empty CVS. And the first thing I thought was, if we buy it now, because I've been working with Shannon. I've drugged Shannon to a million places, along with John Malley. I don't know if he's here, he's a realtor. And I'm like, where are the places on the South Side that we can get warming centers? We gotta get the money to get them renovated now, so we're ready by next year. And then we have all the wraparound there. I think we should have public showers. Find me a sliver. The people come in, they're the most vulnerable then. Let them get bathed, talk to them about what they need. We can do this, y'all, but we gotta do it together. We can do it together, and we're not gonna always agree. This is my counterpart. Sometimes we don't agree. But she has a voice, and I have a voice, and we got like one mission. Let's try to work with people and get them where they need to be, and coordinate the services in a way that is effective and efficient. And then for the folks that will write the checks, give us the money to do the work. Yeah.
Thank you.
guys hear me? I don't know how to adjust
Yeah.
this too well. Okay. So my name's Lindsay. I work with Make a Day. We are a homeless outreach group. I have a lot of things to say on a lot of topics. I'm going to keep it to mostly one, and that is trash, because I have a realistic thing to say about trash, to your point about trash in the community. So I waited a minute because I wanted to get permission that I can talk about this because it's very, very new. Make a Day, the Columbus Coalition for the Homeless, and Jordan's Crossing have worked together on a grant application for trash removal out of homeless encampments and just anywhere that homeless folks are gathering in this city. We think it is a very practical solution. I would get into all the details, we don't have a ton of time, but we have found an incredibly cost-effective way to use city funding to remove trash from the places where these residents are living on the land. It is absolutely not an answer to affordable housing. It is absolutely not an answer to a whole lot of things. But the reason I want all you guys to know about that, one, it is exciting. I'm glad that this is going to happen. Two, with the particular funding that we have for this, it is very, very much a one-time opportunity. It is very much a prove to us that this is worthwhile of city funding. So that is what I'm asking from you guys. Each organization has a different role. Jordan's Crossing's playing the operational role. They got the trash job, no, pun intended. Thank you. The coalition's doing the community outreach, and Make a Day is overseeing the outcomes. So we are going to be sending out surveys to both the people in the encampments that are going to benefit from the hygiene, the sense of dignity, not living in trash. They don't want to live in trash. They don't want to trash your communities. If they're standing in a food line to get food, where that trash goes is the last of their concerns, and I think we can all understand why that would be. So we also are going to provide supplies to the residents of encampments to clean up for themselves. There's no labor being paid for this other than the trash pickup. So what I ask from you guys, the immediate surrounding business and residential communities from where we are, because we can't go to every encampment because we don't have nearly enough money. We're going to be surveying, are you noticing a difference? Is the relationship between you and the homeless community around you different? And do you feel safer, cleaner? Have you benefited from this? The surveys for the community and the residents will obviously be different. Please respond to those because that is the data that I need to prove to the city, look, we tested this, we piloted it, and it is not just an enormous waste of money. We are not just giving a handout. We're doing something that really benefits everybody. So if I come to your door or call you or email you or mail you this survey and we've had this near you, please engage with it because that will help us create a permanent solution. We are going to have people living on the land in the city of Columbus for a really long time, no matter what we do. My other little peanut gallery comment that I want to make is just that if you're not educated on trauma, which 5 years ago I certainly was not educated on trauma. If you are not educated on trauma, you do not know why the folks experiencing homelessness do what they do. And I don't say that to point a finger at anybody who is frustrated because you don't feel safe, because your kids are walking past what they're walking past, because drugs are being used near your house, because this, because that. Yeah, there's a lot of crime, but to quote Emily from Here to Serve, who is more scared, the person that's sleeping in the tent on the street or you in your home who's near them? Not, and that is a direct Emily quote, that is not me, but I think about it every single day. Because it's so powerful. So if you don't know about trauma and you don't know about the effect trauma has on the brain, you do not need a PhD in it at all to understand why people make choices that really don't benefit themselves, why people make choices that don't make sense to you, and why people make choices that harm in your perception in the community. So just kind of do your research on that. Thank you.
Thank you.
We got a couple of minutes and we don't need any comments. Thank you so very much. Appreciate you. We'll talk to you after this is over with. I want to say thank you all of you for being up here on the panel and telling us your side of the story. We know what it is. We've heard it. We've done it. This is a replay, a replay, a replay, a rerun, a rerun, a rerun. Thank you to the residents that came out tonight, those of you who are here, who I recognize, and those that I don't. I appreciate you taking the time to join in the army of this, doing this. My question is not a question. Mine is a comment. Most of y'all know who I am, and so I know some of you were clutching your pearls and clenching your buttocks as to what I would say when I got up here, and I really don't care because I paid my house off, so I'm good. So, like Marty said, she got an acre of land, so I'll send my son to your house. But what I want us all to start thinking about is just what Lindsay was just saying. What is the grassroots of this issue? How did we get here? Some of us have been in this lane, driving down this endless highway way too long. Some of us have seen too many people, some of us on our third and fourth generation of young people who are dealing with having safe, sustainable shelter. We know children that have never been a latchkey kid because they didn't have a thing to have a key to. I remember wearing a key on a string around my neck and going home to watch Bewitched at lunchtime. And you couldn't turn the stove on, so I don't know what the hell they thought you was going to eat, and we didn't have microwaves. But our children don't know the luxuries of having a string around their neck with a key on it. They may never experience having a key to a door they own. They may never have their own bed that they sleep in, that they'll be able to have a normal, adjusted life. Most of us have that structure. So I want everyone in this room to think about, what can you do? Sarah, where you at? Oh, she gave me a little gardening thing, and I don't garden, and if anybody knows me, I have a brown thumb. I have an extra one that I can loan to you if you need to figure out how to dig up to get to the root of why we have homelessness and unsheltered in the city of Columbus.
No, Mike, I'm
up here to say, whatever I can do to help you, I would do to help you. I don't want to keep talking about it because I tell people, we just spent 90 minutes in this room talking about the situation. I would have loved to have us take 70 of those minutes to talk about what are some solutions. How do we address it? They can't come live with me because I already have 15 people in a 2-bedroom house with 1 bath, and I'm going to tell y'all it's not a fun time.
Understood. All right.
Oh, I know we're running short on time, so I'll just be quick. My name is Ryder. I'm speaking as a former member of an organization called Roads for Homes on the West Coast. And it was formed, I'm speaking about the tiny homes that folks have brought up. The organization that I was a part of was formed by literally somebody that worked at an Ace Hardware, said, show up at the Ace today, we're going to be building tiny homes. Starting that day, over the course of a week, we assembled 19 tiny homes, and that grew into an organization that got land funding, that was housing folks in those homes, that was rehabilitating them, that was getting them into jobs. At this point, I obviously don't work with them anymore from Ohio. Every single person that was moved into those tiny homes when I was working with them now have full-time jobs in staple housing. It is a workable solution. As transitional housing, I know to your point that we obviously don't want to be raising rents with substandard housing, with things that we don't want to have people in permanently. But as transitional housing for things to rehabilitate people, they are workable solutions, and it can be done in a short amount of time with community involvement. And we are all gathered here to have this conversation. I'm sure that there is the energy to get that done.
Great.
Thank you.
Thank you. Sir, were you in line in the, no, okay, great. All right, so we are going to wrap up. I'm only 4 minutes over, so that's not bad. One thing that I just want to note is we are definitely, because we've run out of some time to talk about some kind of action steps and where we go from here. So we are going to be sending an email out with some additional information, including, as we're kind of talking about this desire for solutions, the Community Shelter Board is undertaking their community assessment process, and that is to kind of identify what some of those priorities and strategies that we really want to double down on in the coming years is going to culminate in. And so particularly in starting in the beginning of the year, we are going to be doing a lot of feedback collection, so we'll have surveys, focus groups, et cetera. And then in June, we are going to culminate that into a summit where we're all going to sit at tables and get our hands dirty and really kind of try and figure out, okay, how can we make this work the best in order to address the priorities that have come up. So without that, I would like to thank our panelists so much, and I would like to thank all of you for coming out on a very cold night and sitting here and having this conversation. We have a lot of things to discuss and certainly some more information to return to you, so please be looking for an email for that, okay? Thank you.